Yeah, good evening, one and all. It's my pleasure to invite and I'm honored to introduce Dr. Manoj Khanna. Dr. Manoj Khanna is one of the renowned, well-known cosmetic and transplant surgeon in India, not only in India, across the globe. So he's one of the most qualified cosmetic surgeon in India. So it's more than 24 years of experience. To name of the some of the organizations where he is part of, or he was also the part of the associations. He was president of Association of Hair Restoration Surgeons in India for 2012 and 13. He was also president of Indian Association of Aesthetic Plastic Surgeons 2015 and 16. And recent he was for National Secretary of Indian of ISAPS in 2015 to 2019. So if you go to Google and search Dr. Manoj Khanna, you'll be seeing a lot of photographs with a lot of celebrities, especially cricket players and all of the Bollywood stars. So moreover, none other than Dr. Manoj Khanna is with us, and he's also a keen sports person. He likes cricket, he likes tennis, and he's also a commentator on TV and radio as well for cricket and tennis matches. And he was also part of the live telecast of Mother Teresa's funeral on Doordarshan. So I'd like to invite Dr. Manoj to take us through the topic of hair restorations during COVID times and all the guidelines and how the new procedures are taking place, especially in the transplant category. It's all over to you, doctor. Thanks for joining. Thank you all. So we have more than 38 participants as of now. So people are joining. Is it increasing? So I request sir to take on the slides, sir. I'll just stop the share and make you host. You can continue, sir. I have done it, sir.
Very good evening to everybody. These are very difficult times for everybody here in India. We are facing all sorts of challenges for COVID, but it seems that although the numbers are rising, probably COVID is on its way down, and hopefully we should be seeing the end of COVID not too far away. The herd immunity is developing, and fortunately, Indians have responded much better to COVID with regards to the fatality rates compared to the rest of the world. I have no disclosures to make, and the medical profession is probably the most strongly challenged profession at this point of time of COVID, and doing a hair transplant is also difficult. As you know, stress also leads to hair loss, and stress and hair loss is an old friendship. And COVID also, because of stress, there is a lot of patients have increased hair loss and they want to come to you. Clinics were closed for a long while. I was also shut off for more than 2 months. We started in the end of May, beginning of June. And seeing patients and even doing procedures has to be with a lot of caution. There are a number of guidelines, which is by the International Society of Hair Surgery, ISHRS, for patients who are seeking hair surgery and even consultation, which you must follow. And you got to be informed about your own health status, your signs of infection, how to avoid them, and what to do when you're infected in case you get infected, and how to protect others. That's very important. Also, you have to follow the government guidelines. When you have a problem, you got to stay at home and have social distancing, use of masks, sanitizers, facial coverings is important. And the clinic, which has COVID protected facilities, of course, one at a premium nowadays. Doing any surgery in these times, besides doing routine tests, you've got to take a very good history of the patient, whether he had any fever, sore throat, breathing difficulty, cough, or a COVID contact in the last 1 month, and do a COVID test. An RT-PCR, as we know, is about 70% accurate. Probably a better test to be done than the antigen test to let you know whether the patient really has COVID. Even if the patient is negative, you have to take all sorts of precautions when you're doing the surgery. And what we do is, we don't wear a PPE because a PPE makes life so very difficult and cumbersome. At times it's difficult to do surgery, and a surgery like hair transplant needs a lot of accuracy, which is compromised. But keep the patient's face covered all the time. Use a mask. In fact, we tape the mask so that There is no exhale coming out into the atmosphere, and all the uh, persons in the operating room, they also have to have their mask sealed so that contact is minimum. Remember washing your hands, sanitizing them and washing for at least 20 seconds, and not putting your hand to your nose and mouth is probably one of the best ways of staying away from COVID. And these must be followed in the clinic if you want to do any surgery. Coming to the subject of hair transplant, nobody likes to look bald. Ask me, nobody is happy if there's no hair. In this movie Bala, which was there recently, you see Ayushmann Khurrana on the left hand side of the screen and him normally in the right hand side. What a huge difference. The Ayushmann Khurrana without hair looks much older than the real one. Probably Ayushmann would refuse to accept him as his own brother. In fact, there's so much of a difference. And the ability of hair transplant with its advances to give absolutely natural looking results has made a tremendous craze for learning to the procedure and a demand for doing the procedure. That's why people more and more want to do it, because it looks totally normal and natural. There are two different techniques, the strip technique or the FUT and FUE. Both the techniques, the harvesting method is different, but implantation is the same with some differences. I'll come and talk to you about that. So cosmetic surgery, in the world of cosmetic surgery in males, hair transplant is the most wanted cosmetic surgery procedure. And more than 7 to 8 million people all around the world undergo hair transplantation. And what is even more amazing for you to know, that the current market in 2018 for hair transplant in the world was estimated to be 6.5 billion US dollars. 6.5 billion US dollars, but in 2025 projected to be 31 billion US dollars, a 4 times increase in 7 years. So it's a big market, a huge market. And if you don't know hair transplant, please learn how to do it. It will definitely help you improve your practice. The reason hair transplant is very much more common in India and much desirable in India is because we have thicker skin. Fortunately, literally thicker skin than Caucasians. Look at the two pictures. On the left hand side is a very well known figure of Harsha Bhogle, 50 years old. On the right side is a patient from New Zealand, also 50 years old. Both are about equally bald, but the Caucasian, we can see a lot of prominent nasolabial folds, a lot of wrinkles around the eyes, on the forehead, much more signs of aging than the Indian patient at the same age. And only one sitting of a hair transplant in Harsha Bhogle made him look 15 years younger. 15 years younger without any surgery to the face. So the importance of a hair transplant in Indian context is, of course, even much more relevant, because we fortunately have less signs of aging because of our thicker skin. It can make a huge change to your personality, a hair transplant. You can see this patient here, fully bald, grade 7. He had fantastic hair at the back, although not a huge area, but very good quality of hair at the back. And one sitting of a hair transplant, you could harvest. This actually is a world record. I've sent it to Guinness Book of World Records. 10,200 hair follicles, about 6,500 grafts. A huge change in someone. You could cover the entire head, and he looks to be a different person after 9 months of a hair transplant surgery. You can see here, covered almost the entire scalp from the front to the back, except the zone in the whorl area at the back because of the hair follicles in a different direction. He looks a very different person after just one sitting of a hair transplant. The basis of hair transplant is that the hair are permanent and will never fall. As we all know, the hair in the back of the head, in the occipital area, have the quality of not falling, and that donor dominance theory is used to transplant them, bring them to the front. There's a safe donor zone in the back, which is right in the center, and there's a risk of thinning above and below. Well, when you do an FUT, a strip technique, usually you will remain in the safe donor area, which means that there will be minimal loss in subsequent times. Whereas if you do an FUE, many times you might transgress beyond into the areas of thinning, and the hair you take in from those places at times may not survive. You can see the Angar safe zone of hair, which is the blue zone, is the permanent zone which will never fall, and the green zone is a zone which might fall in due course of time. and you have to be careful to harvest as much as possible from the permanent zone, which is mentioned here, which is can be divided into different parts. You can see 8 segments which have been done by the coal safe, FUE safe area, the younger safe zone, which is the same area. And it's important to stay in this area when you do a hair transplant, when you're taking hair from the donor area. The average number of permanent follicular units in average 30-year-old male in type 5, 6, or 7 is between 5,300 to 6,400 follicular units. And remember, the average number of hair follicles in a follicular unit in a Asian patient is about 1.7, unlike a Caucasian which is about 2.3. The important thing to remember when you harvest the hair follicle, whichever technique you are using, is to preserve and save the stem cell which is there in the bulge. Well, this is the area which is responsible for the hair to grow back. There's also a sebaceous gland which provides lubrication and a certain amount of luster to the hair, and of course the matrix and the basement membrane. But the stem cell is very, very important. And what happens is that Indian patients, our hair is much thicker, as I said, than Caucasian hair. Although the number of hair follicles per follicle is less because the hair are thicker. The thickest is Chinese. Chinese are not the most favorite words for Indians nowadays, but that's about 136 compared to 126 in Indians. But you see an Afro-American is only 30. A South African is only 49. A Danish or a European is 64. So they've got much thinner hair. French is 28. And our hair is much thicker. Because it is thicker, it's very important that you maintain this particular thickness when you harvest the hair. And when you do an FUT, when you're seeing under a magnification, under a microscope or a loop, when you cut this hair, the shaft, you will probably having much more tissue around, the peripheral tissue, and staving the stem cell. But if you're doing an FUE and you're using a finer punch, you might hit the stem cell, the bulge, and thereby damage it. And that hair will grow for 2-3 years and not grow back again because it has a damaged stem cell which is going to reproduce the hair. So it's very important that you don't damage the stem cell. And also, thanks to Dr. Mayank for these pictures, many hair are splayed out at the bottom. You see, these hairs which are 3, 4 are splayed out at the bottom and they are wider. So when you are cutting through, don't cut through right till the bottom, for you will even cut these hair, the roots also at the bottom. In fact, what is important is to just cut the muscle layer, the electrodermis pylori, so that you can pull out the hair shaft, the hair follicular unit, and thereby not have a damage to the splayed out hair follicles at the bottom. So the punch side is very important for the Indian patients. Remember, if you look world statistics, 45% use between 1.81 to 0.9 punch, and 45% around 43% use 0.81 to 0.9, 45.91 to 1 mm. It's important that the punch size is well maintained and it is not compromised, for if it is smaller in size, then you might damage the hair follicle and that will create a problem. There are a lot of competition nowadays for hair transplant. People are coming to sir, these people are doing it so cheap, it's not worth doing it. I remember this dialogue given to me by my friend Arun Lal. Which, he said, I went to a shop once a number of years ago, Manoj, and I read there that if you want to buy something good for nothing, which means you want to buy something good, but it's very cheap, it costs you nothing, you will definitely end up getting something which is good for nothing. So don't worry for those people who are doing very cheap hair transplant. Now the technicians are making team and doing that. You stick to what you think is a good price for you, maintain quality, maintain good ethics, and your patients will be happy and get you more patients. Hair transplantation, well, you shampoo your hair because it's a difficult area to sterilize with bead and surgical scalp, day for surgery, morning of operation, and during the surgery before insertion. And I cut the donor hair to about a couple of millimeters. You see here, the donor hair cut short so that it's easy to harvest when you're doing a strip. I will talk about the strip and then I'll talk about FUE as well for the knowledge of everybody, and you can choose what technique suits you best. The anesthetic solution I use is a mixture of 30% cc of 2% xylocaine and 100 cc of saline with 1 cc iodine 1 and 1000. And I also add sensocaine nowadays to increase the length of the anesthesia. I inject the local anesthesia below the donor area. I don't inject in the donor area. I even don't inject the local anesthesia in the recipient area. And I tumesce the donor area well with normal saline till it's turgid and wait for 20 minutes or so before I start doing the surgery. So let's see a little bit of the surgery. I use a parallel multi-bladed handle with the two blades at two ends so I get to have a nice parallel incision above and below. And once I've done that, I'll taper the two ends to make an ellipse using a number 15 blade. And this thereby will be the extent of the strip which I'm going to harvest. I have injected the local anesthesia below, but I have not injected saline here when I've done this marking. And once I've done that, I'll also score the trichophytic incision line, which is a parallel anile, a millimeter or two. It can be above or below the incision. I usually do it below, but you can do it either side. And this is tremendous useful to make the visibility of the scar minimum, because hair will grow through this scar because of trichophytic closure, and they get you better results in the scar area, in the donor area. So to mess well with normal saline, you can see it's getting nice and turgid. And once I've done that and waited for a while, I will then score my incision a little deeper with the number 15 blade. I score and go only into the superficial epidermis and not beyond. I will not go towards the hair follicles, but cut through the epidermis and the superficial dermis, and thereby stay well away from the hair follicles in the lower border, and do the same thing in the upper border, where I score again into the superficial dermis and just below, but well away from the hair follicles, which I'm not getting in contact, so I don't damage any of them, and thereby I can yield maximum number of hair follicles in my procedure. I usually divide this segment into three. Here I'm dividing the left lateral segment of the patient lying prone. And once I've done this, I'm now going to separate the incision line without the scalpel, but using two double hooks. So I'll put two double hooks and then retract them and separate the two incisions. Sometimes the dermis is tough, it will not go through. In some places it's tough, but you're seeing everything very well. In those cases, just nick, very clearly seeing the hair follicles, as you can see here, above and below. No damage to any hair follicle, not touching any hair follicle, and then separating the incision on two sides so that you have been able to separate the two ends and thereby not damage any hair follicle and being able to harvest the strip.
I think doctor got disconnected. I'll just connect him and check. Sir, disconnect हो गया क्या? Sure, sir. Yeah, good evening all. There is a technical issue. I think his laptop got shut down. So he's just connecting 2 minutes. As of now, if you have any questions or anything you would like to ask, you would just put in the question answer box. I think it is a very informative session which is going on. I think I just started the live surgery videos what he had with him. Doctors, if you have any questions, you can just put in the chat box. Yes, sir.
I'll share screen again. Host disabled, participant sharing screen. No, you cannot start your video because your host is not allowed. You have to make me host again, I think. No, it's not happening. I'll get back to the last slide which I was talking. Am I there? Can you see something?
Yes, sir, we can see, sir.
Sorry for that. Can you hear me?
Yes, yes.
Everybody can hear me, please? Hello?
Yeah, you can put in the chat box, doctors.
Can everybody hear me?
Yes, sir. Yes, sir. Yes, sir.
Okay. So sorry that got away. Once I've done that, I'll then remove that piece using number 10 blade. So I can just quietly go in the deeper layer below the strip I've removed, which is just like a floating island now, separated on all sides. And you see hardly any bleeding. All the saline is oozing out. I have not used any adrenaline here. And I can just remove this strip, and thereby the strip is removed, and you are able to get this particular piece out. Once this is done, I'm going to use my scissor to cut the trichophytic incision at the bottom. Is it okay? Is all okay, Chandra? Hello. So here I am cutting the incision with the a scissor. It's only the epidermis which I'm removing, this will epidermis. The idea being that the hair follicles at the bottom will remain and thereby allow hair to grow through the scar which is there. Now I have to close the incision, and I close it in 2 layers, and the deeper layer I always use a non-absorbable suture. And there's a reason for doing that, because any scar stretches for anything between 6 months to 2 years. All absorbable material, even the best material like PDS or monocryl or micryl, they lose 50% of their tensile strength in 3 to 6 weeks. But the scar stretches for 6 months. So you have to use a non-absorbable suture. And see here, I give nice reef knots. My assistant is an expert. Put the forceps in, the artery in, get them to retract together, hold the knot nice and snug, and give good reef knots so that they are secure, they don't slip, they don't allow the incision to be widened apart, and thereby you can get a very good closure. So this I usually do before I remove the trichophytic piece of skin, which I showed you. And once this is done, you can get a good apposition and thereby a good closure, which will get a good scar. I usually will give a number of bites together. I can close by using Proline 40, which the patient can come back to cut. Some patients can't come back, and I use Vital Rapid. I'll give about 20 bites, nice parallel bites, and then using a curved mosquito forceps thin tip, I just pull them out one by one so I can close quickly and comfortably. And most importantly, I have not been pulling every strand which stitch I have given. This helps in the incision to be nice and parallel close. As you can see here, you'll get a very nice closure, so that you can get a very nice closure. And you can see here, nice parallel stitches, very neatly done, and you get a good scar eventually. For slitting, I use 18 and 19G needles. There are some people who use blades. You can do whatever you're comfortable. I had made a Kolkata slit earlier, which was very good when I was using mini grafts. And you can make these slits very quickly and easily. And the best thing is, because it is disposable and cheap, you can just change it when it gets a little dull. For the hairline, the pattern is very important, must be irregular. I use a 19G needle in front. And this is a very important step of a hair transplant. For the hairline, actually tells you the hairline actually tells you the quality of the procedure and the surgeon. So you see, once the slits are made, a big advantage we have, for especially for youngsters, is you can use gentian violet and smear it in that area where the slits have been made, and thereby, after this, when I send the patient for a shampoo and bring him back, this gentian violet will stain the slits made, easy to identify, and insertion becomes easier for the surgeon, especially young novice surgeon. Like you see here, once the patient comes back, nicely visible. The interesting thing here, the slits which have been made must be made in a grid pattern. If you follow this area anywhere, you'll see that two slits, between two slits, a slit is made behind. Between these two slits, this slit is there. Between these two slits, this slit is there. Between these two slits, this slit is there. So that the see-through effect is minimum, and thereby a good, it looks to be nice and thick at the end of the procedure. And you can get good density. Here you see in the transverse axis, it's about 1 slit per millimeter. So then 1 centimeter, you have 10 slits in the transverse axis, and the vertical axis, you will see about 4 or 5 slits in 1 centimeter, which means you can get a density of 40 to 50 follicular units. In areas where looking for higher density, always we don't do that. In other areas, will be 25 or 30 follicles per hair square centimeter, and the coverage will depend on the amount of area to be covered and the hair available. Also, you can do it in between hair, as you see in this woman, but it's important that when you do that, you must see the existing hair follicles and not damage the existing hair. For that will be counter effective, and you might lose hair in case you've damaged while making the slits. While preparing grafts in FUT, it's important to keep them in chilled saline all the time. The grafts, they desiccate very quickly if they're not kept moist. You can keep them in a petri dish. You can keep them on a stockinette, which is immersed in saline, a tray. And we leave a couple of millimeters behind the hair root when you do an FUT, which helps in inserting the grafts. The strip I've taken, you can see, has got almost all the hair roots intact. Have a look. The strip which I had taken out, all the hair roots are intact. That's the beauty of using the double hooks on two sides and the removal that way, because I've not used a knife. All the hair roots you see are intact in the strip. Now we have to do slivering. Slivering is done under magnification. We are using a 20x microscope here. You can 10x or 20x, whatever is comfortable, but you must use magnification. And even the cutting later on, the slivering is always done under magnification using loops or visors. So you cut nicely parallel to the existing follicular units, in between the follicular units, so that you have a sliver which has only one follicular unit, which makes it so very easy for your cutters to cut them out. You can see that thin single row follicular unit slivers, and here you are cutting off the extra fat, leaving enough tissue, of course, perifollicular, as you're doing in the FUT. And this can be done very effectively and easily. You must use sharp instruments, good blade, good light. We do it on a wooden spatula so that there's no damage to the hair roots. And this way, you can get a number of units, which may be, I can see here, 2 hair units, 3 hair units, and single units put on a petri dish on a stockinette. You can also use it as we do nowadays. We use PPP. Dr. Anil Garg has introduced this a couple of years ago, very useful. We do a PRP in the beginning, and the PPP we get, we immerse the grafts in them. It has shown to increase the viability, increase the take, and the grafts are healthier and better in the long run. It's important that when you do a hair transplant, you enjoy the surgery. Your team must enjoy the procedure. If you do not enjoy the procedure and you find it tedious and monotonous, your results can never be good. Having a TV or some light music in the operating room is very useful, and the team must enjoy doing the procedure. Putting the grafts in is a little different FUT and FUE. As you see, it's very important to be most atraumatic. And if you see my the inserter here, only in 1 or 2 movements the graft is put in. Only 1 or 2 movements are required for the graft to be put in. You have to be very, very cautious, meticulous, and there should be minimal trauma. Insertion on the left hand side is different. For the inserter, uses the left hand to push in the graft, unlike the right. So you can see here, only 1 or 2 movements are enough to put in the grafts. And this is very important to be atraumatic, minimal damage to the hair roots, and thereby best results in the long term. All these grafts will take well. Two people can work at the same time. As you see here, on the left hand side there is a insertion going on, and so is on the right hand side, and they're pretty quick. It's in real time video, and you'll see that a good transplant technician who's putting in the grafts will put about 10 to 12 per minute, which means about 600-700 per hour. And so two people together can put about 1500 or 2000 grafts in 1 hour, which makes it very, very quick. In FUE, what we do, we cut the hair short, trim it nice and short, so that you can just see the hair sticking out, which will give an idea of the direction in which you're going to use your punch. And remember, the punch should not go fully down. It should just cut the erectorus pylori muscle, the muscle which will detach the follicle unit. You can pull it out. You go fully down, you're going to damage some hair roots. And here I'm using a 0.9 punch as a very highly magnified, which I'm showing you. Having estimated the length of the hair follicle, you just put the punch in only that much. There are different size of punches available in different lengths, so that you can monitor that, and you keep punching in. And a good punch will be one like this, where it's just popped out. The hair will just immediately pop out, and a bad punch will be like this, where it stays in, where you've actually gone too deep. So this way you can keep punching in with good visibility, and once you've done that, then using 2 forceps, you can pull them out easily. They'll come out. Remember that two hands are very important. For the second hand helps in giving that traction, and you pull in the direction of the hair downwards and not any other way, for you might at times lead to a damage and trauma, and the hair root might stay back. In case it's a little tight, you might need to play with them so that they can come down, and then now you go to the next zone and you keep punching. The advantage in FUE is you can do cherry picking. You can only pick those grafts that have 2 or 3 hair. So you have more hair follicles to be harvested in lesser number of grafts, because unlike the 1.7 average which is there in India that you cut when you do an FUT, here you can choose only chubbier grafts which have got more hair, so that you will be better. So once you've done that, again, as you can see here, you can pull them out. Same technique. Here you see a 3-hair graft being pulled out, another 3-hair graft being pulled out. As I said, cherry pecking, another 3-hair graft being pulled out, and you can have more number of hair follicles in an FUT. It's a teamwork. Remember, you must have somebody who knows the technique of just pulling the grafts out nicely whilst you're doing the extraction using the motor. And here you have the grafts out. There are 3-hair grafts, 2-hair grafts, much thinner than the FUT grafts, as you saw, and so much more delicately to handling to be done to avoid damage. And of course, you might have some hair grafts which have one of the hair has been cut in the 2-hair grafts that you've taken out. The beard is a fantastic area for harvesting in FUE. It can add to your yield to a great extent, and the beard hair are the thicker than scalp hair. They are stronger. You can use, in fact, a thinner punch here, and because they are coarser, they add to the density and make it look better, and very good, especially for the crown area. So you can see here quickly being taken out in these thicker hair, which are a little wirier, the scalp, the beard hair, and also a little curved. And you have to maintain this curvature. You do the insertion. As I showed you, they all are put in this petri dish in PPP. For inserting the FUE grafts, it's important to not hold it from the root, but hold it from the top, from the strand, so that you're not minimal damage is there to the hair we are transplanted to. They're very delicate. There's hardly any tissue around. So you see they're being held from the top, from the shaft of the hair, and being pushed in, unlike FUT, where you can push in from the bottom. And the curvature also has to be maintained. If it's curved, then you have to turn it around so that the proper curvature is there and they grow in the forward direction. The curl has to be towards the hair, towards the skin, and not away from it, and that will not give a good appearance. The discharge is without a headband, without a bandage. I usually give them a headband for 2-3 days. I give steroids for a couple of days to reduce the edema. I of course avoid that in diabetic or hypertensive patients. And you start doing shampooing on the 3rd day after the procedure. It's important to avoid contact with combing, t-shirt or hair oil for 3 weeks. I put them in Minoxidil 1 ml BD from the 3rd day continue for 12 months, and I also give them finasteride 1 milligram daily for about a year. The advantage in FUT, there is no telltale sign. You see this patient after 10 days, you can't make out that any strip was taken. You can't make out from where the hair had been taken. And the shampooing is done clearly. The patient can go back to work without not anybody knowing too much whether any hair was taken. Unlike an FUE, of course, you'll see that. And this, the great result which I showed you of this patient, grade 7 baldness, a fantastic change after 9 months in only one sitting of FUT. And the beauty of a good trichophytic closure. The same patient with that big yield, you see, you can hardly see the scar. The scar after an FUT is hardly visible because of good trichophytic closure, which it makes it so very good for any patient. Another result, huge area. Many people will not do a hair transplant this patient. Grade 7. We did a hair transplant 2 days. The first day I did a strip, an FUT. Second day an FUE from the beard and the scalp. And this guy, after 9 or 10 months, he looks a different person. In fact, the words he said were very, very appropriate. He said, "It is a social rebirth for me. It is such a big change. It's a social rebirth for me, what has happened because of this hair transplant." Another patient, you see the hairline looks so very natural. So it is the doctor actually from Varanasi. Another young guy of 22, lost his hair, very upset. A guy of 45, very good restoration of his hairline and the temporal areas both sides. Another young guy, the same problem. A lot of younger guys are getting bald and looking for hair transplant nowadays. A person 45, fully bald again, big change after one sitting with a very good donor hair. And my friend and brand ambassador, Arun Lal, he's very happy with his hair. He says, "Manoj, you made me look 15 years younger." And of course, this very well-known person, he and probably Salman Khan, the two people who revolutionized the practice of hair transplant surgery in India, because people thought it's not possible. But these two, Salman and Harsha Bhogle in 2007, 2008, when they got the hair transplant done, people realized it works. And then more and more people have been flocking to getting a hair transplant done to restore their looks. Women also can be benefited to a great extent by doing a hair transplant. They usually don't lose their hairline. And if this is a patient of fibrosing alopecia, I've done 2 sittings, but that smile on the girl's face can tell you how happy she is after this procedure. Very important to have a team. I'm fortunate to have a very good team. Only a good team can get a good result of a hair transplant. And if you have these people working with you together, it is they who contribute to the results of a good hair transplant surgeon. I am a cricket fanatic, a cricket buff. I still play a lot of cricket. And I happened to meet Greg Chappell in Kolkata once, and he said a very, very nice line, which I actually have put into the core of my heart. He said, "Success is not by chance, but a matter of choice." Success is not by chance, but a matter of choice. If you have the choice to be a good hair transplant surgeon, the choice to be doing well, then only will you be able to maintain a good team. And you have results like these, people will be happy with you. They'll keep smiling. You will be happy with the results. My thanks to my gurus from whom I learned hair transplant, my teachers in plastic surgery, Dr. Shidra Chowdhury, Dr. Sumit Banerjee, and Dr. S.P. Sen, and everybody, including Dr. Ramchandran in Chennai, with whom I saw my first hair transplant, Dr. Arumugam, Dr. Krugman, Dr. Konier, Dr. Epstein, Dr. Ferjo, Dr. Tubong, many others. Thanks to them, and thanks to all of you, ladies and gentlemen, for a patient listening. Thank you so much.
Thanks a lot, sir. It was such a informative, such a superb presentation. I cannot just see that I was seeing a transplant live. I felt like that. So as of now, we got 3 to 4 questions, doctor. So I would like others also to send your questions in the chat box in the Q&A section. So one first question is, if technician does transplant, does implantation, and doctor does extraction, do we need special consent for that separately?
No, you see, I have been trained by 20 hair transplant surgeons all over the world. And everywhere with this strip or FUT, the surgical part of the surgery must be done by the surgeon. There's a dermatologist or a plastic surgeon or whoever is doing it. You have to extract the strip, close the strip, extract the grafts in FUE. But the cutting, always done by technicians, and the insertion by the technician and the surgeon if he does it. Like, see, the difficult cases I'll do myself. I did an eyebrow transplant yesterday or day before, and I did all the insertion myself because it's a very difficult area. Otherwise, technicians are good enough. You don't need any special consent. It's a protocol all over the world. It's the same. Yes, of course, when the patient comes to you for a consultation, discusses with you, you must talk to them and tell them that these steps I do and this is what done my technician. Because many patients want to do everything which is not possible. I tell them if a surgeon does a hair transplant on own entirely, it will take me 5 days. It's not possible to do, take the strip, do all the cutting, do everything, make all the slits and put all them together on my own. I will need help. But you have to do your steps. That's very important.
Thank you, doctor. Hope doctor, sorry, hope Dr. Sandesh, your query is addressed. So we have one more query, sir. Angle of slits making, can you show us a video or the video what you showed? If you can elaborate your question, there was no name. Angle of the slits while making, you show the video, sir.
I can show the video again, but just to make things clearly for you, the hair in the scalp, they mostly are growing forward. The more lateral you grow, they go front and laterally, and the angle becomes thinner and smaller. Like in the hairline, the angle will be 5 degrees to 10 degrees. In the temporal areas, when you're going to the sideburns, it will become 0 to 5 degrees. So the angle becomes smaller when you come forward, and when you go back, normally it's 30 or 40 degrees. And it's a little easier if you're doing a hair transplant where you have existing hair, and there you can probably use that to where am I going? Use that to make the angle easier. But if there is no existing hair, then you have to follow this pattern, and the easier to do it when you're doing the slitting is turn the patient's head rather than keeping yourself and trying to turn your hand. Turn the patient's head to give you the natural angle. The more anterior you come, the angle becomes more acute. In the hairline, 5 to 10 degrees, even less when you go to the temples, and usually it will be 30 degrees to 40 degrees or even less at times. We'll try and see the video again if possible.
Thank you, doctor. There is message from Dr. Patil. Thank you, sir, for clearing the concept for consent. We have one more question from Dr. Gupta. In trichophytic closure, if margin is cut at upper border instead of lower border, will it make any difference in the final look?
There's no difference whatsoever. As I said in my talk, you can use the upper border or the lower border. The lower border is a little more comfortable and convenient, and also because of the direction of the hair. You see, when you have taken a strip, there will be a slight step at the point of the scar above and below, because the direction is a little more acute, the more you go down. So if you take it from the lower border, probably a little beneficial, but you can take it from the upper border, no problem whatsoever. Whatever is more comfortable, do it. Of course, the entire area where you have done the trichophytic closure, the area must have hair. If it's a bare area, there's no hair at all, there is no point doing a trichophytic closure, because there won't be any hair roots to grow through that. So there must be, you can take 1 or 2 millimeters, there must be some hair, and just remove the epidermis. Remove the epidermis well, don't leave it behind, for then there will be reactions, but don't go too deep that you go and damage the stem cell.
Thank you, doctor. There is the question from Dr. Gajanan Jadhav. How to decrease chances of cobblestone appearance?
It's very important that when you are putting the grafts and you're putting them in, they should not be pushed too much in, or they should not be floating above. When they are floating above, you will have this cobblestoning, because the raised epidermis, which is there along with the graft, will eventually give you an appearance where there's a lot of cobblestoning, like raised appearance. And similarly, if you have put them too much deep, then they may be pitting. So it's important to be just flush. If you are not very happy doing that, or you are not experienced, initially what you can do is, also some surgeons do, they remove the epidermis from the shaft of the follicular unit which they have removed. And by removing the epidermis, then the healing actually is faster, crusting is less, but then that takes a little more time, and you might be able to get away from the cobblestoning. But the graft should not float above the surface, they should be flush, and that will prevent your problem.
Thanks, doctor. So we have a question from Dr. Patil. At the line of partition in front, do we have to implant more grafts, as sometimes density at that point looks little less?
Absolutely correct. Very good. So, and a very important thing is to discuss with the patient which way does he comb his hair. Normally, a right-hander will comb left to right, but some people comb right to left, and that area has to have more density. And even the suppose you are doing only some with grade 2 or grade 3 baldness, with only temporal recession, thinning in the front, and you're going to cover that, then the side in which the parting is there has to have much more density. You have to be thicker, because whatever you do, little less density, the parting will be visible and the patient will not be happy. And you have to use, not only make it more dense, use 2-3 hair follicle unit grafts, so that there's more hair in that area, and thereby the density, the appearance, the number of hair is more, and the patient is happier. This is even more important when you bring it to the female. For female, you usually have a parting line. Female usually don't have a problem in the hairline, but they will have a parting line and they're thin all over. So you could talk to them and discuss what parting line they want, and in that particular zone, put in more hair, which is more density, and also with higher number of hair follicles in every graft.
Thank you, doctor. We have one more question from Dr. Yogita. Hello, sir. Any measurements to draw hairline?
I wish I can show you a video, because it was such a big talk, I didn't know how to finish it. So this thing, you see, there are a number of ways of measuring the hairline. Easiest way is 3 equal parts as the lowest point of the hairline. Or what you can do, put your 4 fingers on the glabella, you'll reach the hairline. But the best way I found to draw a hairline, I learned from one Dr. Sanjeev Vasa, a very senior hair transplant surgeon who's also a plastic surgeon, not really practicing too much of hair transplant now because of age, is that you ask the patient to wrinkle the forehead upwards. Wrinkle your forehead upwards. When you wrinkle your forehead upwards, you will see that the scalp has wrinkles, the forehead has wrinkles, the forehead has wrinkles, but the scalp has no wrinkles. And there is also a difference in color between the forehead and the scalp. And you can easily draw that particular area and draw your hairline, which is very important for the temporal areas. You know, when you have to have that curve, is that if you follow that curve where the forehead has wrinkles and the scalp has no wrinkles, the color is different, you'll be able to get a natural looking hairline. It's very important to do that. And also I've seen that the shape of the hairline is very much similar to your eyebrows. So people who have got a flatter eyebrow, you'll see the hairline is flatter, the scalp is flatter, the skull is flatter, and the raised eyebrows usually have a little raised hairline. So 4 fingers is good, measurements is good, but the best technique, ask the patient to wrinkle the forehead, see the wrinkles on the forehead, scalp has no wrinkles, the color is different, and you'll get a good hairline. Try it, give them my email or WhatsApp number, Shuman, and can anybody any questions, you can get back to me directly also, no problem.
Sorry. We have one more question from Dr. Gupta. What is the PPP you use for graft holding?
Well, you can use the solution to use I initially always use normal saline. You can use zinc lactate, normal saline. There are a number of solutions available. But now what we are doing, which is found to be very good after Anil Garg did that publication of using PPP as a holding solution. So do a PRP just before you're taking the strip, and the PRP taken out from that particular area is injected from that particular procedure you have done, is injected into the scalp in the recipient area, and also into the area where there are existing hair maybe becoming thinner or miniaturized. And the PPP is available, is a very good graft holding solution. So put all the grafts in the PPP, which is there, and because it's from your own body, it does very well. The grafts remain better, the survival is better, the growth is faster, the growth is earlier, and that is useful as a graft holding solution.
Thank you, doctor. I think we have a last question from Dr. Gajanan Jadhav again. Can we split follicular unit into single hair follicle?
Suppose somebody has a lot of only 2 and 3 hair follicular units and doesn't have enough single hair, and you want a single hair for the hairline, you can definitely cut them. Or suppose you're doing an eyebrow transplant, you use only single hair, or you're doing a beard transplant, you do more of single and 2 hair, then you need to split them. But on the other side, there are times when a person has too many single hair. Now, single hair will not give you density, will not give you good result. So there what you can do, which I'm saying, which is just the opposite of what the question was, you can use family follicular units. Means you take two single hair follicles or three single hair follicles and insert it into one gap, into one slit. So they have had two or three hairs instead of one, which you would have had if you had only put in the single hair graft. So you can also use family follicular units. And of course, if you are running short of single hair, or you need only single hair, you're doing an eyebrow, something else, then you can use cut the two hair, three hair grafts into single hair. Of course, important to leave some tissue around it, some perifollicular tissue, and not damage the bulge which has a stem cell.
Thanks a lot, sir. And Dr. Gajanan Jadhav was also posted. Thanks a lot. So we have Dr. Tilakeshwari. I think she has raised hand. Madam, would you like to speak, or you want to ask any question? I can make you a panelist.
Would you like to see the video of? I think we saw that, right? About
yes, they have again asked, sir, can you play the video of slit making?
She had a longer video, but I have not used that here. Okay, we'll try and go slow when we do that. The important thing while I'm making a slit is to make the slits in a grid pattern. Don't make them just in a straight line, one behind the other, because then they'll be see-through. Make a grid pattern. Let's see. Let's try and play this. It's not gone. I should have play from the current slide. Okay, hold on. Let me start with this maybe. All right. So here you see it's in the, I am come quite anteriorly near the hairline. So I'm using this 18G needle. I am doing sagittal slits. You can also do coronal slits. And at a degree of about 30 degrees behind the hairline, I'm making the slits. Okay, let's see it once again. So making the slits at a degree of about 30 degrees or less with the 18G, taking your time. Don't be in a hurry. Don't do it in a messy field. It must be nice and clean so that there is no bleeding and you can see what you're doing. And behind this, in front of this rather, in the hairline, you make irregular pattern, bunches of 7-8 hair, which can be in a semicircular shape, in a triangular shape, in a linear shape, in a quadrilateral shape, whatever you want, but different shapes, no fixed pattern, which actually should go and mingle with your existing slits you made behind. You know, it should go and meet the existing slits behind. So it seems to be coming off from there. There should be no gap in between. That's important. And so you see the slits here. Let me try and get back. You see, if you see the slits here, you will see in between these two slits is this slit. In between these two slits, can you understand what I'm saying? Is it visible? Hello? Can you understand?
Yes, sir. It is visible,
in between
sir.
These two slits is this slit. In between, say, these two slits is this slit. In between these two slits is this slit. So that in between the slits, the grid pattern, so that you will have more density and that will make it better. And that is very important. Again, let's see it here. You'll see here again. Let me smudge it. You see, in between these two is this. In between these two is this. That's very important when you do a hair transplant. And then you go back. The density is high here. It's a little less at the back. There was some existing hair which I have cut. You can make it less to cover a larger, depending on what you have got and what the patient wants. Anything else?
Thank you, sir. Yeah, I think there is no more questions. Any more questions, doctor? You can just post in the Q&A. or in the chat.
I think everybody's tired. It's 1 hour gone that we are doing all this.
Yeah, it's exactly 1 hour now.
I'm sorry for that glitch in the middle because of a problem, but
Not issue, sir. I think we got one more question. Do you use a dye to see the slits? I think you showed that in the video.
you can use a dye in an empty area. So you put it in hair, then everything will become dyed. So in an empty area, or suppose you're a newcomer, you can shave it off. You can see the slits clearly, and then you can put in the grafts one by one. Useful in the beginning. Again, a dye, the problem if you have very dark skinned patient, because very dark skin, the dye may not be that visible.
Thank you, doctor. So we have one more question. How much blood you take out for preparing PPP for graft holding?
You see, if you really want to get a good amount of PPP, you should take 40 to 50 cc of blood. Now that's quite a lot of blood, and then you go to centrifuge and make your PRP and PPP. Usually we'll take about 20 cc of blood, but suppose we are doing a bigger area, more hair will be needed, or you want to get a better result. In some cases, you can 40 to 50 cc is the ideal situation, the ideal amount of blood you should take to get enough PP, uh, uh, PRP, to get enough PRP also for the recipient area, and of course the PPP 20 cc is good enough actually to cover put in the grafts, even for a big case.
We got one more question from Dr. Purag. What density of follicles is advised in transplant?
You see, many patients ask the same question because of the internet available, and they have read a few things left and right, and they will ask you. You see, what you want is not numerical density, but cosmetic density. So you'll have to be more dense in the front, in the parting area, in the temporal areas, and the more you go behind, depending on the amount of area you want to cover, you'll have to make it less dense. In the front, you can go anything between 40 to 50 follicles per square centimeter, but average density throughout is about 30, 25, 30, 35, depending on the quality of his hair, the diameter of his hair, the yield available, the area to be covered, etc., etc. If I did too dense all around, then the area which was so much will only cover so much, much less. And that would not help my purpose. It would be just like a fencing around and the rest would be bald. So you have to balance depending on the requirement of the patient, the area to be covered. 25, 30 follicular units per square centimeter is a good density all around. But in the front, in the frontal tuft, 40 to 50 square centimeters would be much better, ideal.
Thank you, doctor. I think Gajanan Jadhav, sir, yes, he has asked one more question. How long post hair transplant minoxidil and finasteride are to be used?
You see, what I do, which I'll advise all youngsters and anybody else to do, is I take a picture before the surgery and I take a picture immediately after the surgery, because the after the surgery is important for areas of transplant. Many times the patient will tell you, sir, you had transplant but no hair here. And I'll show the picture. I didn't do any transplant there. So how can you get new hair? I ask the patient to use minoxidil from the third day for 1 year. I tell them to use it for 1 year. Many patients who are thinning at the back, I have not done any hair transplant, but were bald in the front and I have put hair, they will have improved results at the back. And this then increases the compliance of the patient, but you would make them understand that the transplanted hair need no minoxidil. I'm only using minoxidil to get them to grow faster, grow earlier. But the other hair which are existing, which may fall, which have a chance of falling because of the genetic reasons, improve with the minoxidil. And using it for a longer period of time will make them better, will keep them, will hold on to them, and you'll be happy with that. So this 1 year trick is good in two ways. It gets this hair to grow faster, other hair become better, results become better. And if you show the post-op picture of what I transplanted, what result he's got, you'll understand the use of minoxidil to save any other hair which have lost. The entire thing becomes counterproductive.
Thank you, sir. I think we are done with the question and answer. So thanks a lot for your patience. And we had 17 questions. We had long questions. We had 17 questions to be answered. So I request you to make me the host again. I would like my RSM, Mr. Subhasis Bhadra, to join us, and thank you for such a wonderful session for all of us. Thank you, sir. Done, sir. Sir, you can unmute yourself and speak.
Sir, good evening, sir. Sir, thank you for taking time out and making this program a successful one, very enriching program. And also, I thank all the attendee doctors for participating. It is a very interactive sessions in terms of question and answers. And also thanks to Mr. Shuman Dhal and Mr. Pavitra Haldar for coordinating. Thanks. Thanks, everybody.
So thanks a lot on behalf of Curatio and all my colleagues. We have also, my bosses have joined. Thanks a lot. It was a very wonderful session about the technique, how to see, a lot of interest, because seeing the questions, I understood it was a very interactive session and many of them videos they would like. So I request all the doctors, if you have any questions or any more questions to be asked, so you can, once the meeting is over, you'll be receiving a questionnaire and along with a form. You can send that, or I'll just post my mail ID so that you can just go type the questions and I can get it answered from doctor.
Thank you very much. It was I hope it's been useful to everybody, and we'll catch up again.
Sure. Thanks a lot, doctor.
Thank you.
Thank you all for joining. Thank you. Bye, sir.
Thank you, sir.
Bye, sir.